secondary AML difficult to treat. The best, haploidentical may overcome some of the bad signal in secondary AML. And we know from the biology of transplantation that the graft-versus-leukemia effect, which is extremely important in transplant, is stronger with peripheral blood than in bone marrow. On the other hand, the graft-versus-host disease, that is the main obstacle for successful transplant, is stronger with peripheral blood. So we ask whether bone marrow or peripheral blood is the preferable graft for secondary AML. This study were done for de novo AML and other malignancies. And here we found that there was no major difference between patients that secondary AML that received bone marrow graft or peripheral blood stem cell, beside some more chronic GvHD as expected in the patients with peripheral blood. But we failed to show that there is stronger graft-versus-leukemia effect or less relapse in patients with secondary AML that received haplo with peripheral blood than bone marrow. So it depends on the starting of the haploidentical from the Baltimore was with bone marrow. Most of the world is giving now peripheral blood because of technical, it's hard to go to the operating room, it's much easier peripheral blood. Here we show that there is no major difference between the two in secondary AML.